In part two of our series on the Affordable Care Act, we talked to Sarasota Memorial Hospital CEO Gwen Mackenzie about Medicaid expansion. She spent days in Tallahassee earlier this year advocating for it, but so far the state has rejected a plan to expand the federal program in Florida. SNN Local News reporter Grant Boxleitner has more.
Florida lawmakers said no to Medicaid expansion in 2013, rejecting a federal component of the Affordable Care Act that could provide health coverage to more than 1 million residents. Sarasota Memorial Hospital and other agencies are now renewing their support for the state to say yes in 2014.
I would call it advocating, and we absolutely will, and I think you'll see some of our community leaders do as well. The Greater Tampa Chamber just last week voted to support as one of their top priorities coverage expansion. So I think we'll continue to advocate for the people here in this region.
SMH CEO Gwen Mackenzie says an expansion of care would help offset rising costs in emergency rooms caused by uninsured patients.
We saw 200 people here yesterday. We'll see another 200 today. Some of those people could be helped by the Affordable Care Act with the coverage expansion, call it Medicaid or anything else. And so we continue to firmly believe that people need primary care access and not emergency room at the latest possible time.
Mackenzie says accepting billions of dollars from the federal government would have a positive effect on the local and state economy.
As a major employer, we're all about jobs and the economic driver for the region, and this would bring this region a substantial number of jobs and economic driving, because this is $51 billion to the state over the next 10 years. And in Sarasota County, that's a substantial amount of money and a substantial amount of jobs.
Reporting in Sarasota, Grant Boxleitner, SNN Local News.
Well, coming up tomorrow in the final part of our series, Mackenzie discusses the ACA starting to close the so-called donut hole in Medicare's prescription drug plan.